Hello and welcome. My name is Dr. Debra Pinals. I serve as a forensic consultant for SMI Adviser. Additionally, I serve as the director of the program in psychiatry, law, and ethics, and as an adjunct clinical professor of psychiatry at the University of Michigan Medical and senior medical and forensic advisor for the National Association of State Mental Health Program Directors. I'm board certified in psychiatry and forensic psychiatry and a diplomat of the American Board of Addiction Medicine. Today, I'll be interviewing Ms. Wanda Nixon and Dr. Elizabeth Ford about their professional experiences preparing individuals with SMI for release from a carceral setting through building strong foundation for reintegration. Ms. Wanda Nixon is a case manager in drug courts for Oakland County, Michigan. She has a wealth of experience as a case manager in the Michigan Reentry Program, providing pre- and post-release services for several correctional facilities across the state of Michigan. She has worked at the intersection of behavioral health and the criminal legal system for over 20 years. Dr. Elizabeth Ford is Director of Mental Health and Criminal Justice Initiatives at Columbia University. Dr. Ford has been in direct care and leadership positions throughout her almost 20-year career, including at Bellevue Hospital and at Rikers Island. I want to start by just opening this up and talking a little bit about your commitments to supporting individuals with SMI during reintegration, because they're inspiring. I've gotten to work with both of you and watch them, and it's truly, you have a wealth of knowledge and experience that I'm looking forward to hearing about. We're eager to hear your practical strategies for preparing people for this critical transition, ensuring a smooth and successful return to the community from whatever carceral setting they may find themselves in. So let me start. I want to direct the first question to Wanda. For the individuals you supported, what would you say were the biggest hurdles that they faced, especially related to their serious mental illness diagnoses, as they prepared to re-enter into the community?
The biggest hurdles that these individuals would face would be stable housing, as well as mental health stability. Those are some of the biggest challenges and hurdles that they face when they're re-entering to society. We want to ensure that they have support in the community, mentally and or financially. So some of the hurdles that they face when re-entering is that most of the individuals do not have stable housing. And so that's one of the biggest challenges. And if they don't have stable housing, then how are they to take mental illness and or themselves or be successful when they re-enter society? So it's very important that they have stable housing when they return to the community, as well as community support. That is one of the biggest challenges and hurdles that they face when they're getting out, not having stable housing and or support in the community.
Yeah, that's really, really helpful. Dr. Ford, from your perspective, what would you say are the biggest hurdles that people with serious mental illness face as they're re-entering the community from carceral settings?
Yeah, thank you. I absolutely agree with what Wanda just said about the biggest hurdles for people with serious mental illness. My experience has been caring for people in a jail system, which is different than the prison system when it comes to reentry planning. And so I do just want to highlight that probably the biggest hurdle there is that oftentimes you don't know when people are leaving. And in a jail setting, there's not a lot of time typically to be able to really get to know an individual, to understand how they're connected to the community, to understand what might be a better connection when they leave. And so I think from my perspective on the sort of jail side of it, it's time. It's that you don't have that time. I would also say that there's very little that I've experienced that relates directly to the illness. It's about, as Wanda mentioned, it's about all of the challenges that come along with having a serious mental illness in this country, like housing, like access to public assistance, access to insurance, access to treatment providers who are interested in caring for that population. And I think that those are really the struggles and the challenges that I have encountered and that patients have reported to me in their transitions out.
It's interesting to hear both those perspectives and from your experience in prisons and jails and different challenges that people can have with their serious mental illness and then getting access to care. That's one of the reasons we love these dialogues is to really try and promote an understanding of those challenges and have other professionals interested in the work be inspired by the work that experienced people are doing. So let me go to the next question. And for this one, I'll start with Dr. Ford. Other people in your professional role, what are some of the biggest challenges preparing someone with serious mental illness who's getting ready for release? In other words, from the psychiatrist's perspective.
I think I would say two big takeaways for the psychiatric profession. The first, from the planning side, if you work in a carceral setting, tolerating a plan that doesn't feel great. It's incredibly challenging to be able to feel confident and secure that when the person leaves custody, they are going to get all of the things that you want them to get, that they will thrive, that they will continue their recovery. So I think being able to understand that you're working in a harm reduction model and to do the best that you can, that takes some effort and some work and is not always the most satisfying. I think that this from a psychiatrist's perspective on the other side, taking care of people who have just come out of carceral settings, I find it has been the case for myself and for many I've worked with that I have to remind myself that this individual, particularly if they're coming out of a long length of stay in a prison and if they've been exposed to solitary confinement, that they have had their decision-making and their autonomy taken away from them for so long that even as adults, even as incredibly bright and thoughtful adults, they haven't practiced making independent decisions. And when you're taking care of adults as a psychiatrist, you're trained, there's an automatic assumption that the person in front of you can make their own decisions and knows how to weigh the risks and benefits of everything. But I think we forget that if you don't practice that skill, it goes away. And to have patience and understanding for the length of time, which can be months to years, to sort of allow somebody to return to the way they were before they were incarcerated.
Yeah, I think that's super interesting. And I know you're not really speaking to their legal capacity to make decisions. It's just more their experience of making independent decisions and weighing judgments and looking at how the world their decisions can impact how they are in the world and their recovery and vice versa. So that's a very interesting point. And what about from a case manager's perspective, Wanda? I know you've worked in partnership with peers and as a case manager for many years. Tell us what you think that you have seen as some of the biggest challenges for the case managers helping people with serious mental illness get ready for release.
I agree with Dr. Ford with some of the things that they're not utilizing their skills. And like she said, it's so much that's been taken away from them when they're in a carceral setting. And some of the challenges and some of the things that I noticed that we face is that they have limited access to medications in the Michigan Department of Corrections. They don't get to utilize all the medications that are available on the outside. There's limited access. So some of them are not stable because they're not getting treated properly on the inside. So that itself is a whole nother challenge because the psychiatrists are very limited to the prescriptions that they can provide with these clients and trying to give them to be stable mentally. So that's a challenge in itself. Proper planning, as she stated earlier, is crucial to how these individuals return to the community. It's crucial because they're inside and they've normalized being inside. So now we have to transition them outside to help them reintegrate and also give them all the tools that they need in order to be successful. It's very important that we create a system to help them be successful when they're on the outside. And that system in itself can be very, very challenging for someone who's normalized being on the inside.
Really excellent points. I think we forget how people adapt to one environment and then how hard it is to shift and adapt to a different environment. And sometimes adaptive skills from inside the carceral setting are maladaptive outside the setting. And that's a whole nother area. So I really love that perspective, Wanda, that you give. So turning back now to Dr. Ford, if you look back at your experiences what do you consider the most crucial aspects of interdisciplinary collaboration in successful reintegration?
Interdisciplinary collaboration is crucial and critical for all aspects of healthcare. Frankly, probably all aspects of work. And I think it's particularly true for reintegration from a carceral setting into the community. I think just having the collaboration in and of itself is a starting point. And I'm not convinced that happens as regularly as it should. And by that, I mean the communication of the carceral team with the community team. And that's different again in jails or prisons. In jails, oftentimes there is not the time or the knowledge about who is in the community. And I think for people who are exiting prison, because there is a release date, there's a little bit more time to plan and connect. I think that the concept of warm hands-offs, which is probably familiar to this audience, is so important, and people talk about it, but I'm not 100% sure that it always happens in the way that is the most patient-centered. And sometimes the warm handoff is just between the providers and doesn't include the individual, which is a key missing part. Then the other part, I would say, from the psychiatrist perspective, is that I think it's really important to recognize that all members of the team are equal in their importance in the role they play for the individual. And the individual is part of that team as well. And so all sorts of disciplines need to be included, as well as family members, if possible, advocates in the community. That it's not just a team of a doctor and a social worker and a nurse. It's the whole group. And I think, sometimes that can be challenging to orchestrate, but I do think it's pretty critical.
Yeah, very helpful, that whole safety net, the whole team approach. Wanda, what about your perspective as a case manager? What do you consider the most crucial aspects of interdisciplinary collaboration in successful reintegration?
This is where I like to highlight the Mission Reentry Program, because we did have the opportunity to collaborate with the providers, the family members, the peers, before the client re-entered. So the reason, and as Dr. Ford said earlier, you don't, in a jail setting, you don't get the opportunity to, plan. And that's the beautiful thing about the Mission Reentry Program. We had the opportunity to plan and to collaborate with the mental health providers before they got out. We created a plan for them so when they did get out, so that they could be successful. So we had the opportunity to link them to the mental health providers before they got out. We had the opportunity to go and visit their family members to see what type of family and or friend support that they had in the community. We had the opportunity to ensure that they had their appointments set up before they got out. So like if they got out in 2 days, they had an appointment within the next 4 days with a mental health provider. So again, that's really the key piece to ensuring that these individuals are going to have everything that they need in order to be successful, is to collaborate with a team of people, to take a team approach to try and help these individuals be successful when they do return to society. So we link them to all those providers to know that we're going to do everything we can to help you. I usually like to say to the clients, you need to wake up and decide you want to be a prisoner. You need to wake up and decide you want to be a criminal. There was some trauma that took place somewhere. And so we like to link them to everything possible so that they can be successful. So when it comes to the interdisciplinary approach and coordination, the Mission Reentry Program, we really thrived in that area because we wanted to ensure that these individuals had everything that they needed to come out and be successful. Our goal is to reduce recidivism, and I think we did a very good job at that.
Yeah, I love that answer. I'm going to throw a different question out just because I have both of you, and I would love to hear your perspectives, Wanda, on advice that you would give mental health professionals on working with case managers.
The advice that I would give a mental health professional is listen. Don't write. Be in the moment with the individual. Because for so long, they've been neglected, abandoned, whatever the case may have been, whatever their story is, it's all trauma related. But to listen, and not only to listen, but to ask them what are their goals, to hear them, to actually be in the moment with them, to ask them, what did you desire? What do you want? And try to create a plan, a doable plan to help them at reach, we all wake up and want to be a millionaire, right? But it takes time, and most of these people just want something as simple as a GED. So what do? Let's create a plan. Here's a plan. Let's try this. Listen to these people. That's so important. And if you burnt out, take some time off. But listen to them. From the humility, it's humility. It's from a humility perspective. The humanistic approach, if you will.
Yeah, it's beautiful. And just to one more push on that note, as the case manager working with mental health professionals, what would you ask for the mental health professionals with regard to you as the case manager? What do you need for that interdisciplinary approach?
Support and flexibility. Support and flexibility is really huge in this area because oftentimes we don't get a lot of support. And oftentimes they're like, no, well, the clients are highly manipulative or there's these anti-personality disorders. We're all aware of that, but we still need flexibility to be able to help these individuals. So flexibility and coordination, listening, creating a plan of action, I think would be very helpful.
And then Dr. Ford, I'm going to go back to you and ask you similarly, from the perspective of a mental health professional, what advice would you have for case managers and peers that you're working with?
Thank you for that question. I think many mental health professionals don't get enough education, training, or exposure to working with multiple disciplines, including people with lived experience and case managers and credible messengers and a whole host of support individuals who are critical. And so my request, I guess, would be for the mental health professionals is to practice humility as much as possible. Particularly people who are trained as physicians, they've been taught that they are the boss throughout their education. And I think when we're talking about this very complicated and important healthcare that we are talking about, no one is the boss except for the individual who we're trying to take care of. And then I know it can be difficult from the case manager's side to, as much as possible, feel comfortable. And I think it's on the physician side to help that happen, speaking up. And if there's a decision that's being made or something that's being discussed that doesn't make sense, that doesn't feel like it's patient-centered, to really speak up. And I know that's a request that really shouldn't have to be made. So I acknowledge that. I think we all, on the mental health professional side, need to sort of recognize the privileged position that we're in, and to be able to, just as Wanda said, be supportive and flexible, and to kind of step back from all the education and privilege we've been afforded, and to really just see the team and everybody on the team as people working together.
Dr. Ford, what do you find most rewarding about the reentry work that you're doing?
What I do find incredibly rewarding is being able to get to know and learn from the individuals and the patients. I mean, it feels, and I've used this word before in here, but it feels just like such a privilege to be in a position where I can ask questions and develop, hopefully, a trusting relationship with someone, and they'll talk about things that they won't share in other places. And that's, I think, the beauty of mental health work and psychiatry. But I find that incredibly rewarding, that human connection that comes in a way that really doesn't happen in sort of everyday life. So I know that's not exactly the answer to your question. I kind of wish that reentry work was not a thing. But I do find the human connection really quite rewarding.
Yes, I think that's a really thoughtful response. And reentry work does imply that there is carceral, detention and confinement, and that's, one of the challenges in our society is to think about that in a broader scale. And then that human connection just is such a powerful thing. I really relate to that. Wanda, what do you find meaningful about the work of reentry?
Meaningful. I actually have to piggyback on something Dr. Ford said as well, as you kind of recorded it. So thank you for the question as well. The human approach, having humility, the connection, building rapport with individuals that have been incarcerated for so long, just having that connection with them, building that rapport with them inside and maintaining that rapport with them outside. Is crucial because I'm running into individuals who really want wants to make a difference in their lives. They don't want to keep returning to prison. They actually want a job. They want a life. They want a family. Just watching them blossom to become a great human in their community, a great father or a great mother, or something minute that we would consider minute or that we consider small, but just watching those small things turn into something so big for them. Just obtaining a job and being able to hold a job for a year or even 6 months for someone who's never had a job. So those things are probably the most rewarding for me, or to hear a client say, "You're the first person that actually listens to me, and it seems like you really do care." For me, to know that I made an impact on these individuals going forward, whether they return or whether they overdose, whatever the case may be, I know that I made an impact on their lives in a positive way. So I know I kind of went pretty much around the question, but that's the most rewarding part to me, knowing that I gave my all. And I always say I rest in the evening because I know that I did my very best. So it's their choice after that. I know that I did my part. And knowing that I did my part is the most important piece.
Yeah. Also, sir, when I think about, the light we all carry within us to do good and to help individuals, on a person level, on a systems level, it's incredible. And you both really exemplify real heroes in this work. And that's why I'm so delighted to have this opportunity to dialogue with you. I really want to thank you for sharing your experiences and knowledge, preparing individuals with SMI for release from carceral settings. The tactics you shared, including humility, listening, support, and taking care of oneself to avoid the burnout that might come with this work because it is so weighty, really will benefit practitioners of all levels working in correctional settings and with those who are released from those settings. So thank you very much for your participation in this dialogue.